like we're at 2:01, so I'm going to ask everyone to put your phones on mute, please, and we'll invite Dr. Gardner to speak whenever he is ready.
Okay, everybody, it's Dr. Gardner. I'm beginning now. Hello, I'm Dr. Charles Gardner, Medical Officer of Health for the Simcoe Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe Muskoka. So I last reported a week ago on February the 23rd, and we now have 6,525 cases. We've had an actual 9% decline in our total case count that week, the week of the 21st, compared with the week before that. To be specific, 251 cases as opposed to 276 the week before. I'd actually spoken on Sunday as well about our case count, and at that point I noted that we'd had a 15% reduction, but when we have a couple more days after, we make sure that we've been able to gather up all of the cases that have been reported. So in fact, there's been a little bit of a higher case count last week than we'd initially thought. And as I'd indicated, if you go through the trend, last week it was 251 cases. The week before that, the week of the 14th of February, it was 276, which was up about 30% from the week before that, at 211 for the week of the 7th of February. And before that, you had a trend of week-on-week downward case counts from the beginning of January, when we had peaked out with the second wave. So we've had 2 deaths since I reported a week ago, and I would like to express my condolences to the family members for your loss. These 2 people are a woman who is between the ages of 45 and 64, and a man more than 80 years of age. In the month of February, we've had a total of 31 people who've passed away, and the total deaths that we've had to date is 189. So that's up from 187 a week ago. So far this week, we've had 47 cases reported to us. 40 are sporadic. 1 is associated with an institutional outbreak. 5 are workplace related, and 1 is from an educational setting. 26 are male and 21 female. Their ages range from under 10 to over 70. 43 of them are from Simcoe County and 4 in the District of Muskoka. 2 are community acquired, which means that we don't know how they were acquired. 23 are from close contacts. 1 is from an institutional outbreak. 5 are workplace outbreaks, 1 an educational setting, and 15 of the cases are under investigation. 46 of them are self-isolating, and so 1 is isolating in an institutional outbreak. We have a total of 468 active cases, down from 564. And 5,816 that have recovered, up from 5,504. We have 18 cases that are in hospital among Simcoe Muskoka residents, which is down from 24 cases. Their ages range from their 40s to their 80s. All of them are from Simcoe County, and seven of them are in the intensive care unit. Located in a variety of locations: RVH, Southlake Regional Health Center, Stevenson Memorial Hospital, Princess Margaret Hospital, Corticelli Vaughan Hospital, and North York Hospital. The vast majority of our cases reside in South Simcoe and Barrie, so Barrie, Bradford, West Gwillimbury, New Tecumseth, and Innisfil. The weekly incidence of cases in Barrie is 72.3 per 100,000 population per week, and this is down from last week at 108 per 100,000 population. Penetanguishene actually has a very high case count of 196 cases per 100,000 population per week, and this is because of an outbreak at CNCC and at Waypoint. Currently, we have 28 outbreaks happening, so this is up from 16 last week. 6 are in long-term care facilities, 2 in retirement homes, 1 is in a hospital, 1 a correctional facility, 13 workplaces, 2 community settings, and 3 educational settings. So we have 10 of these in institutions, up from 6 a week ago. 4 new ones: Mill Creek Long-Term Care Facility in Barrie, Woods Park Long-Term Care Facility in Barrie, Barrie View Retirement Home in Barrie, and CNCC in Penetanguishene. And so none have been declared over in the interim. We have no outbreaks in congregate settings. We have 13 outbreaks in workplaces, up from 7 a week ago. So 8 are new. 4 are in manufacturing settings in Simcoe County. 1 in an agricultural setting in Simcoe County, 1 in food and beverage location in Muskoka, a finance and insurance location in Simcoe County, and a personal service setting in Simcoe County. We have 1 that's declared over, a professional, scientific, and technical services location in Simcoe County. We have 2 outbreaks in community settings, which is up from 1 a week ago. So a new one, ambulatory health care services in Simcoe County. And we have 3 outbreaks in educational settings, up from 2. And 3 of them are located as follows: Maple Grove Public School in Barrie, St. Teresa High School in Midland, and a child care setting in Simcoe County. And 1 declared over, Innisfil Central Public School in Innisfil. And we also had a private school that has been declared over as an outbreak. We have I have the following information with regards to our variants of concern, such as the B117 UK variant, but also others that have tested positive on screening for a variant of concern, awaiting confirmation as to whether or not it is the UK variant. So certainly I have a lot of focus on that right now, and I believe the whole community does, given that the main rationale for declaring this district to be in the lockdown gray status is because of our very large number of variants of concern in our district. So at this point, we have a total of 543 cases, and they break down as follows. 191 of those cases are confirmed to be the UK variant, the B117, which is up from 171, and 352 are screened positive for the mutation that indicates that it's a variant of concern. We call it the N501Y mutation. So these are screened positive individuals awaiting confirmation as to whether or not it's the UK variant or if it's some other variant. As I said, 352 of those, and this is up from 216 a week ago. We've also received, of course, negative results as well. Although the majority of our cases of COVID-19 in our district are a variant of concern, we still, of course, have many that are not. So by location, 97% of our cases have been in Simcoe County, including in Barrie, the majority actually in Barrie. So 527 in total in Simcoe County, as opposed to 16 of them in Muskoka. All of the confirmed B117 UK variants are in Simcoe County, so the cases that have occurred in Muskoka haven't been confirmed yet to be the UK variant. And so 47% of our cases in Simcoe County have been linked with an outbreak, and so the remainder of them are independent, sporadic cases. And thus the majority, in fact, are cases that have been spreading through the community and not identified with an outbreak. And in Muskoka, 33% have been associated with an outbreak, so the majority have been not part of an outbreak in Muskoka as well. Expressed another way, 57% of all of our cases are sporadic. Some of those are noted to be secondary transmissions from an outbreak. So outbreaks, cases that have occurred in household members or social contacts of those that are part of a facility outbreak, staff typically. So if you look at that 57%, 37% are secondary transmission from the outbreaks. So a good portion of them are due to identifiable as linked indirectly to the outbreak in question. We have week on week increasing numbers of cases. So just to be clear, and this is an important thing to look at, because this really tells you whether it's increasing week on week or if it's peaked and potentially coming down. And so if we look at all of our VOCs, or variants of concern, they total as follows. During the week of the 31st of January, from that point forward for 7 days, we had 55 cases of VOCs in total. The following week, the week of the 7th, we had 71. The following week, the 14th, we had 119. But the following week, the week of February the 21st, we were down to 100. So that perhaps is a bit of a good sign. We're having continued transmission for sure, and we're having continued outbreaks for sure, but it's possible that this has peaked and is coming down. I think 1 week is too soon to say, but that's the data that we have right now. And 65% of the most recent week's cases have been sporadic cases not linked to outbreaks. 17% of them have been part of outbreaks, and 18% have been secondary cases from outbreaks. The family, social contacts of staff, typically, that are part of outbreaks. Okay, so at this point, 66% of the 66% of our cases of COVID-19 have been a variant of concern. So 2/3 of our cases are a variant of concern, which is very high compared with what we've seen in other health units. Others that I've heard of have been in the range of 20% or less. And so we are definitely trending in time upward when it comes to the percentage of our cases of COVID-19 that are variants of concern. So the week of February the 7th to the 13th, 54% of our cases of COVID-19 were variants of concern, and the week of February the 27th, it went up to 65%. Okay. If we look at the present week, from February the 28th onward, and this is not a complete week, but since we have the remainder of the week ahead of us, but so far this week, 71% of our COVID-19 cases are in fact a variant of concern. So that's trending really as we expected. We knew from the experience of other countries that it's more communicable and it comes to dominate as this strain in the community. takes over essentially as a circulating strain. And when we look at our outbreaks, we had the week of February the 7th, 3 VOC outbreaks, variants of concern outbreaks. When we look at the week of the 14th, we had a total of 6 outbreaks, and 5 of them were due to the variants of concern. And then when we look at the week of the 21st, we had a total of 10 outbreaks, and 5 of those outbreaks were variants of concern. So, and most recently we've had both variants of concern as outbreaks and then non-variant outbreaks. So if we look at the work environments in which these outbreaks of variants of concern have been happening, it's been in manufacturing, in agriculture, in food and beverage service locations, actually 2 of those, essentially restaurants, as well as a personal service setting. This is a category that includes spas and salons and hair cutting. So we now have one of those as well. And workplaces make up the biggest proportion of our current and total outbreaks of COVID-19. Of course, we've had facility outbreaks as well. At the very beginning, we had, of course, 2 large long-term care facility outbreaks and a hospital outbreak, and since then we've had other long-term care facility outbreaks, although much smaller in terms of numbers, really attesting to the importance of immunization as a way of protecting the residents from COVID-19 in general and from variants of concern. So if we want to look at specifics here about the total to date, we've had 25 outbreaks, and this is up from 15 a week ago. 8 of those have been from the B117 variant, the UK variant, and this is up from 6 a week ago. And we've had 18 of the 25 variants of concern. 18 of them were screened positive for the mutation that identifies a variant of concern, but awaiting confirmation as to which variant. And that is up from 9 a week ago. So the type of locations, 8 are in institutions. This is up from 4 a week ago. 15 are in workplaces, which is up from 12 a week ago. 1 is in a child care center, which is unchanged from a week ago, and 1 is in a community service setting, which is ongoing from a week ago. And by location, 22 of them are in Simcoe County, up from 15 a week ago, and 3 are in Muskoka. And I recall actually reporting a week ago that there were 2 that were happening at that time. If we look at the details about our institutional outbreaks, we've had 4 are as follows: Bradford Valley, with 18 positive VOC test results, 13 found to be the B117 UK variant. Waypoint, 19 positive screen results for variant of concern, 12 of which turned out to be confirmed to be B117, the UK variant. Sarah Vista Long-Term Care Facility had confirmation as being actually just the mutation that's screened, the N501Y mutation. So the screening test awaiting confirmation as to which variant it is, and the same with Barrie Manor. They've had 5 positive screening results awaiting confirmation as to which type of variant. Educational setting, the child care center was positive for the mutation screen awaiting confirmation as to which type. The workplace settings, as I mentioned, we have 12 of those. 2 of them have been confirmed to be the UK variant B117, and the remaining 10 are screen positive with the mutation, awaiting confirmation as to which variant. The community setting outbreak was confirmed to be the B117 UK variant. And then we have a number of other institutions that have been declared over as variants of concern outbreaks. So a total of 7 have been declared over, which is unchanged from a week ago. So 4 of those were the UK variant, B117, and 3 were screen positive, awaiting confirmation. So to be specific, institutional outbreaks 4, Roberta Place was found to be the UK variant, B117, at a total of 111 positive screen tests, 88 of which were then confirmed to be the UK variant. Georgian Traditions Long-Term Care Facility had under 5 test results shown to be the B117 outbreak variant of concern. And then Simcoe Manor was found to be screen positive, awaiting confirmation as to which variant. And then we have workplaces, 2 of which were found to have the UK variant, and 1 of which was screen positive, awaiting confirmation as to which type. So moving on to immunization, as of March the 1st, we've administered 42,000 doses of vaccine, and this is up by 7,000 doses last week. And yesterday we launched our community clinic. So up until now, we've had only 1 fixed location providing vaccine, and through this week we're opening up another 12 throughout Simcoe, Muskoka, and all 6 sub-regions in Simcoe, Muskoka. Anywhere between 1 and 3 clinics in each of those locations. And yesterday we opened the first 4 of those and provided just over 1,000 vaccinations at those sites. So a very good start. If we look at our agency's dashboard, and this is different from the provincial framework, for a very long time we were sitting at red. And I'd like to say this dashboard does not include any kind of tallying of the impact of the variants of concern, and we're looking at that now to determine exactly how we would take the variants of concern into account with that dashboard. But without any consideration of the variants of concern, we've actually gone down from red to yellow. And the reason for that is because we've noted some reduction in the viral spread, improvement of viral containment. We noted some reduction from last week in the total case count per 100,000 population. What's gone up, of course, in the wrong direction is the number of outbreaks. There's been a decrease in hospitalizations, and our reproduction number actually went down. It was a high of 1.4 last week, and now it's down to 1.0. Laboratory testing, the turnaround time remains below the goal of 60% return within a day, and the percent positivity has gone down slightly to 1.5, so it's yellow, unchanged. Health system capacity remains yellow, unchanged from a week ago in terms of acute bed occupancy, which is nearing 90%, it's 81%, and ICU bed occupancy and ventilation bed occupancy are both green. Public health system capacity is red, remaining unchanged, and this is because we remain challenged in our ability to respond to cases within the desired 24 hours, the target being 90%, and our ability to do that declined to 69.7% from 77% a week ago because of the complexity of our outbreaks that we're responding to, the complexity of the cases and their contacts, driven very much by the the UK variant, the variants of concern, and our desire to be very thorough in our follow-up on them. In terms of our trajectory, our weekly incidence is 42 cases per 100,000 population per week. I had reported on the weekend that it was 39, but as I've noted, when we were able to move away a couple of days, we're able to make sure that we've got all the cases for the week. So it's actually up to 42.2 cases per 100,000 population per week. This is down from last week at 46.4. And as I noted before that, week on week, it was coming down and then had gone up 30% up to that figure of 46.4. The tally for Ontario is 51.8 per 100,000 population per week, which is up slightly from a week ago at 50.9 cases per 100,000 population per week. And this is actually closer for us than we generally have been to the province. Generally, we've been riding at about half the level of the province. We're very close now to being at the same level as the province. And as I've mentioned, our reproduction number is down to 1 from what I had been a week ago at 1.4. Our doubling time is about 4 months. If we continue at this rate of growth, we double the total number of cases in 4 months. Okay. In the past, I've gone over in great detail all of the outbreaks, and this time of shifting the approach with this. I do have detailed information about all of the outbreaks, but I think I would just wait to see if there's any questions about any of the particular outbreaks to get into the details. And instead, I've covered a fair amount of detail about outbreak changes, and also put in place a fair amount of detail about the VOCs, the variants of concern, and how they played out with regards to outbreaks. And instead, I will move on to my media notes. So we are in gray lockdown status, and I did report on this on an interim basis on Sunday and reflected the difficulty of this that I've heard from many, many people, probably over 200 emails now, of people's concerns about this. The great majority of them very much opposed to moving to gray. For a variety of reasons, centered, I think, a lot of it on a sense that it's not warranted, that the numbers don't show it, that the burden of illness isn't sufficiently high or the risk isn't sufficiently high. And also concern about economic impact on businesses, impact on people's livelihood, impact on their access to cherished activities such as dance classes and physical fitness classes and other services that people enjoy, and the negative impact that has on their well-being, their children's well-being, on their mental health. So I've certainly had a very tangible sense of that communicated to me. I'm now starting to hear from councils of municipalities with motions of opposition as well. I've had further discussion with political leaders in municipal councils. I have ongoing communication with our MPPs. I have a regular meeting with our MPPs, and yesterday was one of those meetings. And so I certainly walked through everything about the situation with them, and they've been offering a lot of support as to how do we move forward? How do we move and improve to the point that we can come out of this status? That's the most common question that I receive and give a lot of thought to, and have had internal consultation as well with my team members about that very question, and also with the Chief Medical Officer of Health for the province, Dr. David Williams. What I would say is I'm very much aware of the difficulty, the harm, and the great desire to move away from this. I've also heard from some people that support this protection, this precautionary approach, and have wanted me to know that. So I take that into account as well. We need to keep sight of my original concern about the variants of concern, the potential for them to cause a third wave, as has happened in some other countries. and that potential can go up if they become dominant, which they are here. But to me and my team, the bottom line is actually, as these move and become more and more dominant, what are they doing to the total case count? And what are they doing to the total number of outbreaks? And is that edging up or moving up or not? And although it looked like it was going up quite steeply when I reported on this a week ago, in the latter part of the week it did not, leveled out, came down as a total count. And the VOCs of concern have gone up, but I've just noted to you earlier that the past week they may have come down slightly compared with the week before as well. Certainly the outbreaks are continuing and increasing. The number of cases that are unattached in the community are increasing. The geographic spread of this is increasing. So we have a mixed, complex picture, but in talking with my colleagues about this, the real bottom line is, what does this do to the total case count? And what does it do to vulnerable populations that are more likely to have severe outcomes and even death? And there, the most obvious group is those who are in long-term care facilities and congregate settings, seniors in particular. We've done a lot to protect them in the interim since we first had our major outbreaks with large numbers of cases and deaths from variants of concern in facilities. We've now managed to immunize all of those facilities, so that greatly reduces the risk. And that, I think, is an important factor to consider as well. So I'm in ongoing daily communication with the Chief Medical Officer of Health, Dr. David Williams. At the end of the day, I can advise, but it's actually his decision what to take to Cabinet to make a decision about change. And keeping him informed about how these trends are going. And we need to really look at, what does it do to the total case count? Does that actually go up, or does that not go up? And in the days to come, we are certainly watching that closely to see that trend and see if it goes as it has in some European countries and resulted in a great leap of cases, or whether it actually doesn't materialize as such. To me, that would be absolutely a critical deciding point to advise the province on where to go with this. With regards to our vaccinations, I've already spoken to the successes that we've had with that. We've been very fortunate to be able to do a launch yesterday, and we had some coverage of that, and it was very good to get together with all the many partners and partner agencies that have made our community vaccination clinics possible. So it's certainly been our municipalities that have provided us with the venues and the facilities to do this, primary care agencies, Ontario health teams, family health teams, community health centers that have joined us in planning locally. Many of them already had plans for us to simply lift and use based on their experience with influenza immunization and the provision of their own staff to join our staff for immunization. And we also have had support and participation from paramedic services with Simcoe County and the District of Muskoka. And hospitals have provided their support. Certainly from the very beginning, RVH has been foundational to all of this. The vaccine is still their primary responsibility as the receivers of it. And they remain a critical partner in all of this. And the main operators of our first clinic that will remain in operation on Sperling Drive. And community pharmacists as well are critical partners in all of this. So very good to be able to have 13 clinics running through the week. We also are fortunate to have our own booking system. The province will not have their booking system up and running until the 15th of March, they tell us. And so we plan on having our own as a backup, and that will remain in operation until the province is is in place, and then we will roll over to using their booking system. So we have an online means of booking as well as telephone intake. We've had tremendous interest and uptake about immunization. It's important for people to know that we are following the province's priority groups in sequence over time, starting with those that are at greatest risk and those that are most likely to contract it through their work. So frontline healthcare workers and also the residents of long-term care facilities and retirement homes, congregate settings, home care recipients, the Indigenous adult population. So we have, I'm very happy to say, also provided immunization to our 4 First Nations communities last week, and our priority groups now include the adult Indigenous population that's 55 and above, as well as their household members. So we were happy to provide that service, happy to provide immunization to the general population that's 85 years of age and older, and would intend to be able to move to 80 and older in time for the province's goal for the 15th of March. We'll take it one step at a time, but that's our intention. And otherwise providing immunization to healthcare workers that are considered to be very high risk at this time. So they've been notified and been given the option for how they can book, and they would be the individuals who their work includes direct care to COVID patients. And this actually includes first responders who provide that kind of care as well. So paramedic services, firefighters, and police officers who provide emergency resuscitative or emergency care are priority to receive the vaccine, have been actually starting late last week for police and continuing. So we've had with our booking system an online system, but also a phone means, so calling our Health Connection line at the health unit. And we do have an overflow process as well, so that if our system is overloaded, it's seamlessly transferred to supports at the City of Barrie, Aurelia, the District of Muskoka, and Simcoe County. And we have started receiving some 10,000 calls a day with everything that's happening and with the immunizations, as opposed to our usual 300 calls a day that we get. So that is certainly an unprecedented volume of telephone calls coming. We do our very best to be able to meet that demand, but there may be some wait at times for people. And we have limited numbers of spots that we can book in any one week. We're only booking out a week at a time to be more assured of the volume of vaccine that we'll be getting. And, thus we have a waiting list for people as well. But it's important that people come forward when they are in the priority group. We won't be providing immunization to people that aren't in the priority groups. We'll be asking for them to wait for when their priority group arises in the weeks and months to come. So today we start actually 3 clinics, 3 of the 13, and one is at, just to let you know, one is at the Barrie Holly Centre, one is Midland North Simcoe Recreational Centre, and one the Alliston Arena. But this is for appointment only. You have to have booked to receive immunization, and so if people drop in, they will not be receiving immunization. They'll be given information about how they can book. It's very important that people come on, like, not too early, because we're trying to avoid waiting times because of infection prevention and control, and also to avoid people having to wait outside in the cold. We will have much more detailed information about the variants of concern on our website, and such as the UK variant, the B117 variant, and those that have screened positive awaiting confirmation as to their type. And that's going to include information about the outbreaks and the sporadic cases, and how that's trending in time and how Simcoe varies from Muskoka in time. And 7-day rolling average of the number of cases. So we intend to have that up in the very near future, targeting by tomorrow at the latest. So at this point, I'm going to go through some media questions that I've received in advance. So many seniors, 85 plus, living in supportive housing or who have physically or mentally compromised status aren't able to get out to a clinic to get their vaccination. What accommodations are available to them? So that's a very good question. We do plan on setting up pop-up clinics and mobile teams. We do have mobile teams continuing to provide immunization in the remaining group home congregate settings where seniors are provided care. But we intend in the future, when we get a larger volume, to be able to do that kind of thing elsewhere in the community where you're finding congregations of seniors to make it easier for them. I don't have details on that at this time, but that is our intention, and we certainly will communicate it as we go forward. Will the immunization be brought to a senior setting that would normally have a flu clinic held on site to support the population? I'd say yes, in the manner that I've just described. When a senior 85 plus who currently qualifies for an immunization lives with an elderly partner or caregiver who is under 85 but still a senior, can both be immunized if the younger of the two is the essential caregiver for the person 85 plus? And I'm afraid the answer to that is no. For the general population, we are going to be sticking with the age criteria, and so we'd be happy to provide the immunization to the individual coming with, that's the individual coming who is 85 plus, and others with that individual, if they're not 85 plus, they wouldn't be receiving the vaccine unless they fall into another priority group. If they happen to also be a healthcare worker that's in the very high risk category, then they would qualify. For example, if they're an adult Indigenous individual who's 55 plus or a household member of such an individual, that they would also qualify at this time. Certainly, people, we want to, through time, be able to provide this vaccination to everybody who's eligible, the entire adult population. So we would certainly encourage people who don't qualify yet to come when we're ready for them, when their priority group comes up, and we will communicate as we go about that. How long is this lockdown for? Will you advise Premier Ford to put us back in the red immediately? If not, why not? So I have reflected on this, and what I would say is we are providing information daily to the Chief MOH. We are looking at the trend with the variants, but I think more importantly looking at how that impacts on overall cases of COVID-19 and whether it will result in a surge in overall cases. And we will monitor that over the days to come and keep the Chief MOH informed with regards to the decision about timing of coming out of lockdown. I don't have a definitive answer for you at this time as to when. How many cases are linked to nail or hair or gym businesses that we need to close them down? Why not restrict big box stores or even lower capacity limits? So what I would say is we're following the province's framework as it is described for lockdown gray status, and that includes the personal service settings, the gymnasiums, fitness centers being closed. And the rationale for their closure would really go back to the fact that they have been places of transmission in other outbreaks in the past. Some of them here, we've certainly had outbreaks here in personal service settings and in restaurants, for example. and some of them not here, but elsewhere in the province. And so that would be the rationale for their inclusion in the gray category. With regards to retail and what's open and what's not, and allowing people to attend in retail, even though it's reduced occupancy, that is a decision that has been made by the province in the past. For the very first shutdown in the spring, even they were closed apart from food, the purchasing of food in grocery stores. The others were curbside service, so that's a decision that rests with the province. And in terms of numbers, I've indicated that with this outbreak, with this VOCs, variants of concern, cases and outbreaks that we've had 2 restaurants and a personal service setting so far that have been part of those cases have been outbreaks in those locations. When do you find out each week how much vaccine we're getting? Is supply increasing? So we get for predictions of this going out 2 weeks, about a week in advance, 2 weeks out into the future. And then we get final confirmation a couple of days before it actually arrives, and typically arriving Monday, but it can be later in the week. And so far the supply has been about the same that it's been over the last few weeks, so not increasing in the immediate future, though from communications from General Rick Hillier, who is leading vaccination distribution, the table on this, he's anticipating larger volumes of vaccine to come, including the newly approved AstraZeneca vaccine, which will be helpful to us because it's fridge stable and therefore easier to move and use and potentially take to pharmacies or people's homes, or more opportunities for its use. It's also more restricted in that it's going to be approved in the province for under 65 years of age. So why don't you share where the cases of the variant are and where are the communities where they're located? So as I indicated, we're putting up a lot more information shortly about the variants, the trends, the outbreaks, Simcoe versus Muskoka. And other than that, we haven't alluded to the locations of individual cases of COVID-19, either by lower tier municipality, apart from in the aggregate. If you look at our website, you can see totals by municipality for COVID as a whole. And so we're going to be providing information about the variant with regards to Simcoe versus Muskoka, and have a look at whether we take it even further to lower tier, but at this point it'd be Simcoe versus Muskoka. So at this point, I would be happy to take questions.
Thank you very much, Dr. Gardner. We're going to start with Mandy Webster from Rogers. Hi, Dr. Gardner. How are you?
I'm doing okay. How are you?
Good, thank you. I just have a question in regards to something that came out in BC. They had changed their guidelines for providing the second vaccine, delaying it for 4 months. And I'm just curious as to whether Ontario is looking at this and if it's a good idea.
I thought it was just terrific when I read that, and I'd had a bit of a heads up that that was coming, and I have no doubt that the province is looking at this and that there would be communication on this, I anticipate shortly, though I don't know for sure. But it would be immensely helpful to us, because if we can delay considerably the timing for a second dose, we can move more quickly to giving more people their first dose. And these vaccines, more and more research is coming out showing that they're highly effective even with a single dose, at least for some weeks to come. The more quickly we can give people protection, the more quickly we can bring down our overall numbers, the more quickly we could address the variants of concern, and the more quickly we could move back to more normal living.
And just a couple follow-ups to that. You said that it is shown that it's still just as effective. Does it do anything to the effectiveness of it by waiting that long, even though it goes against what the manufacturers are saying?
My understanding from the research is that it can be in the range of 90% for the two mRNA vaccines, Pfizer and Moderna, and that it doesn't appear to be waning at least for that 4-month period of time.
Okay, do you think, sorry, last follow-up, do you think people will be more hesitant to get vaccinated, knowing that there'll be that longer wait period?
I don't have data that would speak to that, but I don't know why that would be. I think, I mean, judging by the enormous number of calls that we're getting per day for this 10,000, there's an enormous interest in getting vaccinated. I think the great majority of people see the tremendous value of it.
Great, thank you so much.
You're welcome.
We'll move on to James Bowler from Cogeco, please. James?
Thank you very much. Dr. Gardner, just moving away from variants of concern and lockdowns right now, I have questions about testing and screening in the area. I've heard concerns from some people that testing is pretty restrictive right now, especially for parents, being that it's a 9 to 5 ability right now in Muskoka. They're having to travel to Aurelia or other places in order to get tested, especially the kids tested. Is this something that health unit can be fixing? You know, what's the scenario here? Can we move more testing up here that would be outside the regular 9 to 5 weekday hours?
Thank you for the question. I just had a look now at our trending graph of tests per 10,000 population, Simcoe versus Muskoka, and I do see that in fact Muskoka has dropped considerably. It looks like it's a drop from about a drop in half, actually, from 150 tests per 100,000 population per week to 7. It looks like about 75. So I think you raise an important point, and it doesn't. It looks like Simcoe too has dropped, but not by nearly the same amount. And Simcoe is considerably higher than Muskoka. You raise a good point. I will look into that.
That's great, thank you. My other question is about contact tracing. The other concerns I've heard from residents is that the contact tracing seems to be slow right now. One story I heard was that somebody hadn't heard until 4 days later that they'd been in contact with somebody who had COVID-19. So what is the restrictive nature of that right now? Is that something that can be sped up as well?
So, and that would be in keeping with our own tracking, our dashboard, in which we've indicated that our capacity in public health is red status, and we've actually had some decline in our turnaround time for contacting cases and contacts. Our approach with the managing the VOCs has meant that we are being a lot more detailed in taking histories and providing information and following up on things. And we're having an increased number of outbreaks, which is a drain on our resources as well. We've also started to lose the additional support we had from some other health units with their personnel because they're experiencing more cases, and so they've needed their case and contact workers back. So we've lost on that front. So we are finding ourselves challenged.
Okay, thank you.
You're welcome.
Okay, we're going to go on to Alison Brownlee from Muskoka Region.
Thank you very much. Dr. Gardner, are the Bracebridge and Huntsville community vaccination clinics operating right now?
Huntsville was operating yesterday. I don't think it was either that was operating today. So we have, unfortunately, a very limited volume of vaccine. And we do very much anticipate getting much more. We're anticipating eventually getting the kind of volume of vaccine that we would, the amount that we're giving in a week, we'd be giving in a day, like 7,000 doses is like the capacity we would be able to give in a day. But right now it's much lower, and so we've had to essentially ration it among the clinics throughout Simcoe, Muskoka, which means they can't all operate every day. And we're allocating based on a combination of population size and the incidence of disease, and very much the size of the priority populations in those communities.
Thank you.
You're welcome.
My second question sort of follows from that. As you are well aware, there's a lot of frustration in Muskoka. There's frustration because of inconsistency in which measures and which data we're going to find ourselves in. I think there's frustration because of the differences in service levels, not only between Simcoe and Muskoka, but within Muskoka itself, in terms of who has access to what, and who's going to be hosting what. Why do we have that inconsistency, and how do we get consistency to help address this frustration? Because it's very real here.
I'm afraid I would need a better sense as to these discrepancies, these differences. I don't have a good sense of it, of what you're alluding to, I'm afraid.
I can try to help clarify that.
Okay.
It's just that we know there are 13 community immunization clinics that's going to be opening across Muskoka when the volume of vaccine is available. We know that 2 of those are going to be in Muskoka. We know that Gravenhurst, for example, is disappointed to say the least that they won't be having a clinic. And we know that other communities like Muskoka Lakes or Georgian Bay would like to see clinics as well.
Okay.
We know there's going to be mobile clinics. Those aren't yet available. So we're being held in Muskoka to the same lockdown standard as Simcoe, but we don't seem to be getting the same access to vaccine for reasons, but there's those optics still. So what can we say to people who are obviously frustrated about provincial decisions and about access to vaccination?
Yeah, thank you. Now I understand. My answer would be the pop-up clinics when we got the volume to be able to do it, and we intend to go to many small communities, and certainly Gravenhurst when that happens. And I've received, very well-articulated case from the mayor of Gravenhurst as to why Gravenhurst should have a clinic. So we're certainly taking that under advisement and looking at what we can change. But when I reflect on what you're saying, one thing that occurs to me is that Muskoka's geographic size is similar to Simcoe County. And we've allocated, the number of clinics roughly based on population. And Muskoka has a much more dispersed, much lower population, which means you end up with 2 of these clinics, and there are 11 in Simcoe County. It's Muskoka, the same geographic size as Simcoe, but 2 versus 11. So I can see what you're saying. That would appear to be a type of inequity. In terms of population size, it wouldn't be inequitable, but in terms of geographic distance and spread, it would be. So I thank you for that observation. The best answer I can give would be the pop-up clinics, but I will take that under advisement.
Thank you very much.
You're welcome.
All right. We will go on to Brett Glover from Barrie 360.
Hi there, it's Ian from Barrie 360.
My apologies.
No worries. Thank you, Dr. Gardner. One question was already answered regarding dosage and availability of vaccine. But talking to people out in Collingwood, the BIA, the council, etc., I think a lot of people up there are trying to get their heads wrapped around the fact that, they can't get a haircut in Collingwood, but they can grab simply the stone's throw several kilometers away to Grey Bruce, and those opportunities are there because they're in green in such a short distance travel time. I know you didn't design the provincial framework. They would like to be rolled back to possibly red. You can't, I guess, do a cookie-cutter approach to Simcoe Muskoka. That's not viable.
So if you're talking about taking a sub-region approach, I hear that most commonly raised. I'm sorry, I heard maybe that was.
That's what I meant. Yeah.
Yeah, I hear that most commonly raised about Muskoka, and I think they probably have the strongest argument because their distance is greater and their numbers are very consistently much less than Simcoe County. But it's raised in other locations, and it's certainly often framed more recently about South Georgian Bay having proximity to Grey County. I hear the argument. I think it takes us back to what's the proper designation for the entire district as well. How long do we remain in shutdown and lockdown grace status? Is the trend of cases does that justify it or not? At what point can you say that it doesn't? So to me, that would be the better way of addressing it. Going forward in the future, I think as long as the pandemic continues, need to consider certainly the difference between Muskoka versus Simcoe.
Thank you.
You're welcome.
We'll move on to Craig Momney from CTV Barrie, please.
Hey, Dr. Gardner. Just a question about local businesses not complying with the recent lockdown. What are your thoughts about this, including restaurants that are continuing to do dine-in, tanning salons, continuing to accept customers as well?
I must say that I expected it, considering the response that I received, the emails that I received, and I've instructed my staff that we need to take a very careful approach, considering the common sentiment. We need to take an educational, gentle approach. I want them to tally and note this for me in my communications to the province. Actually, in communication this morning with my staff, they were not aware of many, but then again, they felt they might not be aware of many right off the top. We aren't actively going out to find this out. We will rely on complaints from individuals to find this out, or other means of reporting. So there probably is quite a bit of, if it's there, we're not yet aware of a lot of it yet, at least as of this morning, but that doesn't mean it's not there.
And that petition that was started this past weekend now has over 21,000 signatures on it. Does that surprise you at all that they're supporting these local businesses and wanting to continue to reopen it and be moved back to red?
Well, it's certainly something that I've taken note of. It emerged early, like through the weekend. It was there and growing rapidly. It was brought to my attention by emails from people, so I'm not surprised. I think it's just it's yet another indicator of the opposition to all of this.
And I guess lastly, just one more. Do you still stand by the decision to move to, or push to move to gray?
I think what I need to do is move forward from here. Hindsight's 20/20. When you move into something, you get this degree of opposition. You have to question it. But we need to move forward from here and see how do we move on from here? How do we deal with this?
All right, thank you very much.
You're welcome.
We'll move on to Matthew Riesler from Moose FM, please.
Yes, just to follow up on my colleague Allison's question about the vaccination clinic. I spoke with Mayor Paul Kelly this morning about how they currently don't have one, and he said he did reach out to you, and you mentioned that you were having a conversation with them. What was the thought process that went behind putting a sensor in Bracebridge and still not one in Ravenhurst?
So I'm just going to repeat the question because it didn't come across very loudly, and so it might not have been picked up on my Facebook broadcast. And the question was, what was the thought that went into not setting up a clinic in Gravenhurst as opposed to Bracebridge and Huntsville? And it was a process that my staff followed. Sorry, I've got an echo going on. If people could please mute their line, that'd be great. Thank you. My staff followed a local planning process with the partners in the community, a family health team, hospital, municipalities, and the Ontario Health Team where there is one. We had an appointed lead from my health unit to each of those communities, and each one drafted up a plan that would work for them locally. And so we had one of those for Muskoka as one of our 6 subregions. The subregions were actually based on the geography under the former local health integration networks. So we followed that process, and the locations that we have came out of that process. Beyond that, I actually do not know offhand the answer to your question.
said that he is going to continue pushing to get a clinic in Gravehurst, much like he did earlier, or late last year with the testing center at the Farmers Drug Mart in Gravehurst. Do you expect, I know it might be tough to answer, but do you expect the clinic will be open, a full clinic like in Bracebridge, Huntsville, Gravehurst at some point in the future?
So just to repeat your question again, Mayor Kelly's going to continue to push for a clinic in Gravenhurst, and do I expect that that would be the outcome, even though it's looking to the future, a bit of a crystal ball? I'm committed to responding well to his request and to working with my staff and the partners to look at that and to improve the situation. I'm afraid I don't. At this point, I don't have the definitive answer about the outcome.
And last question, hopefully you might be a little louder this time. We've been hearing in Muskoka a lot about protests and people, businesses that are going to be staying open despite needing to close or work on a reduced limit. How is the health unit going to handle potential protests, whether at the health unit office or at other places within Muskoka or Simcoe County, or businesses staying open when they should be closed or working at a reduced limit?
So the question was, there's reports of potential protests. There are reports of businesses that will not close. How will the health unit handle those, whether the protests would be at the health unit site or elsewhere? So we've certainly instructed our staff about the potential for protests. We respect the democratic rights of individuals to protest as long as it's done in a lawful and safe way. And if it's not, then we would need to use the police as an authority to help make sure that it is. But otherwise, we would respect it. Our staff has been given instruction on how to manage and deal with such, to not put themselves in danger if they feel endangered in any way. So that would be if it's in a location that would affect the movement of our staff, whether at our office or otherwise. But on the whole, we respect that. We actually have put out in the past guidelines about safer protesting with regards to COVID-19 as a risk. So gatherings can be a risk, and so we have guidelines that we would advise people follow in order to reduce their risk, such as the use of masks and physical distancing. And with regards to facilities, businesses that are remaining open contrary to the regulation, I've instructed my staff to be very careful and take an education approach, given the strong sentiment at this time.
Okay, thank you, Doctor.
You're welcome.
Adrian Prokovic from IFM.
Proceed, yes. Thank you. Dr. Berger, you mentioned that you're in contact with Dr. Williams constantly. Now, when Simcoe Muskoka moved into the gray zone, was it a request to go into the gray zone, or would you prefer that we go back into the stay-at-home order in an effort to control COVID transmission?
I made a recommendation that there would be an added restriction to address the variants of concern. I wasn't sure at that time what the options were, and I learned that the gray zone would be the option. Stay-at-home shutdown will not be an option going forward. There are 3 health units that remain in shutdown, but going back into it, I was told, it was not an option.
Okay, so that's off the table. Would that have worked better?
It would have been more strict, and I think that given the reaction, it probably would have been an even stronger negative reaction.
Right. But as far as controlling the transmission, it seems to be working in the first place. Where you have, controlled it better. It had one element to it that I felt was very helpful back when we were in shutdown, and that was the stay-at-home order. It made for very clear messaging
to the public about what was needed, that the simplest message about reducing your risk and reducing transmission in the community was to stay at home and only go out for essential purposes and not have people over to your home and not go over to other people's home. And it was a simple and clear message when I was able to state that that was actually a requirement rather than just a recommendation.
Right. Okay. All right. Thank you.
You're welcome.
Don Housephone from the Huntsville Doctor, please.
Thank you. I'm wondering about the rationale for keeping some businesses open, or maybe not for keeping them open, but for repercussions for businesses that have large outbreaks that occur. We're seeing concern from places like personal services where they have had transmission in the past in that industry. They're being asked to shut down completely right now, whereas restaurants, for example, McDonald's comes to mind in particular, where they've had a large number, in some instances, of staff cases, but there don't seem to be any repercussions for those businesses. I'm wondering if you could comment on that.
I would say that the framework is not perfect. It's hard, really impossible to get a perfect framework about this kind of thing. It's been changed over time too, right? It's actually been changed to be more permissive. Lockdown is more permissive than it was before the shutdown. So some of the rationale went into it was about the nature of the risks. So personal service settings, you have people in much closer proximity, clients and staff. I know that there are a lot of practices in place to reduce that risk, but still the close proximity for prolonged periods of time are inherently more risky than the kind of encounters that you would have in, say, retail, generally speaking. So that would be part of the rationale. Another part would be the experience of outbreaks. So there have been outbreaks, and we've had them here too in personal service settings. We've had them in restaurants too, among staff. So in that regard, I think your question is fair. These are work environments that can continue to have outbreaks, even if it is restricted to takeout only or delivery only. It's still possible for them to have outbreaks if they're operating.
And I understand that this is a provincial decision, not a Health Unit one, but what would you say to those businesses that are being forced to close right now, who are looking at the very real possibility of losing their businesses because of these repeated restrictions?
I would say that I've certainly heard from many of them, and that I've got a very tangible now sense of their feeling about it, their anger about it, their frustration about it, that I am certainly taking that to heart as I continue to communicate with the province, Dr. David Williams, and to advise.
Thank you.
You're welcome.
Sean Gibson from Barrie today, please.
Hi, thank you. Just a couple questions. One is, for those that aren't understanding the numbers or who don't know what to look for, Dr. Gardner, what would you say are the ideal numbers for us to go into red and be comfortable there? And not saying that we're going to keep going, but at that point that we're probably really trending in a good direction. What should people look for?
I've really given quite a bit of thought to this and in discussion with my colleagues and like my colleagues here at the Health Unit. And we expect that, in fact, the VOCs will take over completely or mostly as the strain of COVID-19 here. That's been the pattern elsewhere. So we have to expect that. And so the real key question is, what does that do to the total case count? Does it cause it to skyrocket up, or does it not actually affect it much or at all? And so that's one of the key things that we're going to be monitoring. That and vulnerable locations. What does it do to seniors, to severe illness, to mortality, to facilities that have those that are very vulnerable? And there I note vaccination has already had a major benefit to address that issue.
And then just follow up, this was a copy of what when you proposed to the government or to the Ministry of Health of the province restrictions, as you said before, to go into the gray or to have more restrictions when we were in red, how much say do you have there? Do you just suggest which direction we should go, and can you alter it, or is that in the provincial government making the calls and then it's out of your hands?
I would say that ultimately it is a government decision, and very much heavily influenced with the advice given to government by the Chief Medical Officer of Health. But I would also say, in my experience, that the Chief Medical Officer of Health takes very seriously the recommendations and the information, the evidence brought forward by local medical officers of health. So at this point in time, I think I found that we were I appeared to be very influential, given those dynamics.
Perfect. Great, thank you.
You're welcome.
Thank you. We're going to move on to Erica Engel, calling with Today, please.
Thank you. Hi, Dr. Gardner. I was wondering if you've seen any changes or trends in transmission when it comes to the VOC. There's been some talk of elsewhere. It looks like it's easier to transmit it, so you don't need as much time with the person.
Yeah.
Have you seen that through your patient contact, that kind of transmission here as well?
I'd say the strongest indicator of that was the very first outbreak that we had at Roberta Place, where within the course of a weekend, we went from a single known case to well over 50 cases throughout the entire facility. And then in the course of the 2-3 weeks that followed, almost all of the residents and well over half of the staff affected. So that gave us a very strong impression that it moved quickly and was very easily spread. And on that basis, we've actually taken an approach, the province has taken an approach of reducing the required exposure time for a high-risk exposure. It had been 15 minutes if you don't have proper personal protective equipment, and now it's essentially any time at all, apart from simply passing a person. We don't include that, but otherwise spending any time at all if you're not properly protected with both parties using masks or full personal protective equipment. We're considering that to be a high-risk exposure. And that has led to us having a lot more contacts for us to follow up, which has been part of the added burden of our work and the challenge that we've had in keeping up with case and contact management.
Okay. The other thing that I'm hearing from mayors is they're expressing this thought that the numbers don't justify the lockdown, and they feel they haven't been given an explanation. You explained the reason that you advised the lockdown was the variance of concern. So what about this criticism that they haven't been given an explanation? Do you feel you have given one?
I've given it through the media. I've actually given a written document yesterday, just probably being distributed today, through the Chamber of Commerce to all of the businesses. Now that you're speaking to me about this, I think it would be wise of me to also circulate that to municipal politicians. I certainly, I speak every week with the CAOs of Simcoe, Muskoka, and so on Thursday, so last Thursday, even before this was declared, I advised them that this was a possibility and why. In that regard, I've given explanation, but you can never over-communicate, and it's true that I've not directly addressed a forum for all of the councils, say in Simcoe, Muskoka. All 26 councils that we have here, I've not done that.
Thank you.
You're welcome.
And we'll move on to Chris Simon from the Barrie Advance, please.
Thank you very much. Dr. Gardner, what would you rather see happen? That
At this point, what I'd rather see... Sorry, I've got an echo. If people could mute the line. There we go. At this point, what I'd rather see is that we take a careful and gentle approach with the businesses, that I continue communicating as needed about this, that I continue to hear from people about their concerns, that the numbers hopefully will not result in a surge and stay stable. And in terms of the overall numbers, we're seeing an expansion of the VOCs, but as I identified, we're now very much focusing on what do they do to overall COVID case counts. I would like to see that not happen, that it remains stable or go down, and that we'd be able to move out of the shutdown status in a fairly short period of time. I can't identify exactly how quickly that would be. I wouldn't want for the framework to be changed at this time quickly because of what we're experiencing. I think that kind of thing needs to be done very carefully and thoughtfully by the province about the tool and how it's used to meet the needs of multiple health units, not just ours. So I'd rather that we take the approach we're having now and then work through this and hopefully, if all goes well with the numbers, come out of it. I have become concerned about that, considering the reaction. I have become concerned about that. It's top of mind to me. One can only go forward, and so I am committed to good process, good communication, clarity about what we're doing, hearing people out, improving our methods, and really that's all that I can do, but I have that concern.
Thank you.
You're welcome.
Thank you, Chris. Is there anyone who has not had a chance to ask Dr. Gardner a question today?
Well, hi, Leslie. It's Mark Claremont.
Go ahead, Mark. Do you have two questions for Dr. Gardner?
Yeah, we'll just make it one because I know you're in a hurry. Doctor, it's good to talk to you again. I think this is my third day speaking with you. I just wonder how you're speaking to the media, you're speaking to the 26, the various counselors, the politicians, the staff, David Williams there. I just wonder how and when you get time to sit back and study the data yourself, and how you form your opinion on what should happen. You mentioned around the world, you look at studies and things like that. I just wonder, do you have weight on the local stats, maybe perhaps more so than what you're reading around the world?
So I do have to rely on a lot of other people to help me. Everything that I provide for my update is the result of many people's work. And on the day of these scrums, it's compressed for them too, right? So I rely on a great number of people, and I rely on my colleagues. So I have some excellent colleagues here who follow the literature very well, and I consult with them. I confer with them. We get together as we can, and you've identified that time is short, and I certainly agree with you there. It is a challenge, but I would say at the end of the day, I have a team, and I need a team to be able to do this.
How many hours a day do you put in, just out of curiosity?
Thank you for the question. Before the pandemic, it was probably about 40 hours a week, plus a little bit of some extra professional reading that I enjoy that I wouldn't include in that. Now, at the height of it, it's 60 to 70 hours a week. There are days that are 12 hours, 14 hours long. I can't keep that up for long. I find that I lose my capacity after a while, so I have had to take breaks. We've got things structured so that all of us as team members, we're going to get a week off, maybe every 2 to 3 months kind of thing, just to make sure that we get a break. So I have to do that to be able to function, but it's been very demanding. The whole of the pandemic has been very demanding on us all.
Okay, well, all the best to you. Good luck.
Thank you very much.
Thank you, everyone. That's all the questions we have from the media today, and so we will meet back up with you in the days to come, and this will be added to our Facebook Live, and you can find it on YouTube if you need to go back and check any of the answers. Thank you very much, everyone. Thank you, Dr. Gardner.
Thank you, and goodbye, everybody.
Bye.